If we come up here again, you want to have some direct control over the femur. Don't just hold it down at the foot. You know, what I like about this position too is it'll actually give you a little feedback. They'll tell you, hey, it kind of pinches in the front when I do this. I'm aware of something going on. So in reality, what you're doing when you go into flexion and internal rotation up at 90 degrees is you're actually doing somewhat of a provocative test for more elastable impingement. Okay, and I'm not saying you should be doing provocative tests as strength and conditioning coaches, but I do know that we get people in these positions every time we do a lunge, every time we do a squat. So I'd much rather have it in an unloaded position and get a feel for where their hip stiffness really is and know, hey, this is something we need to be cognizant of. Because if I have someone who comes in on their first evaluation, I take them up into 90 degrees of hip flexion and then they jump off the table the second we check internal rotation, it's going to be a little bit of a red flag, and I'm going to say, hey, we got to keep an eye on this. And usually those folks, they're going to kind of go into their squat pattern, and then it's going to look something like this, where they're going to shift towards the affected side because there's probably something going on. So if they do get some kind of symptoms there, that's something you got to keep in mind. Is this someone I need to refer out to get an X-ray on that hip, especially with the symptoms they have? Maybe you ask them more questions about what their health history looks like. They forgot to write something down that you haven't seen. But I think the other thing that you can do here is some quick modifiers. One thing I like to do is if we see someone who reports like kind of a feeling of stiffness or just a very limited hip internal rotation like Matt kind of presents with, is I'll just ask them, hey, can you give me a little bit of posterior pelvic tilt? So kind of flatten your low back out, engage your core like I'm going to punch you in the stomach, and then what we'll do is we'll retest that internal rotation. And in many cases, they'll actually get a pretty good reduction in either symptoms, stiffness, or they'll improve their range of motion. Simply because all we've done by giving them that little bit of posterior tilt is we've freed things up to give that femoral head a little bit more room to glide in hip flexion. And in many cases, that's going to help that internal rotation along.